Hello, I am Dr. Jet. I am a doctor specializing in emergency medicine. Today, let's look at an interesting case for resuscitation. Suppose we encounter a patient on the street who may have been stabbed in the chest, resulting in a laceration, with a large hole in the chest. We see that this is a significant injury, with air escaping. If we look at the medical terminology, the term for a laceration in medical language is laceration, which means a large tear. This laceration occurs in the chest area, and what I mean is that this is the wound, and here we can see the ribs. The remaining part of the ribs consists of muscle, and the wound also has fat beneath the skin. It appears that this wound is a very large tear, and we can see the ribs as well. We also notice bubbles of air coming out. What does this make us think of? This makes us think of what is called open pneumothorax, which I will explain further. This wound is quite large, and this is something that rescuers need to know, because there is a method we need to use to close the wound. The three-sided dressing should be applied to the wound to allow the lung to continue expanding. I saw this image sent by some emergency responders, and they wanted to convey that sometimes, if we receive a patient at the hospital, but do not take care of the wound properly or provide adequate emergency first aid, the patient may worsen and even die. This is something we need to be aware of. We should also wear gloves when handling this situation. What is called open pneumothorax is actually a condition of pneumothorax, which is a rupture of the pleura. We can categorize it into accidental and non-accidental cases. If it is not an accident, it is referred to as simple pneumothorax, which is a normal rupture of the pleura. This can occur in tall young individuals who may suddenly experience a rupture. However, this case is an accident, and it may involve tension pneumothorax as well. In this case, I will focus on open pneumothorax. The image I have drawn depicts a large laceration, and you can see the ribs. There is also air bubbles coming out. If a rescue team encounters a case like this, how should we care for the patient? The patient will present with shortness of breath, and you can see the ribs and the penetrating laceration. Let's look at the next content and see what to do next. This is what is called open pneumothorax. The next image is referred to as open pneumothorax, but what is open pneumothorax? In English, it is written as open pneumothorax.